Why discuss OTC medications with your stroke doctor? Have you ever wondered why it is important to talk about over-the-counter medications with your stroke doctor? It might seem like a small detail, but it can have significant implications for your health. Over-the-counter medications can interact with the prescribed medications you take for stroke management. This interaction can affect your stroke risk factors and influence your recovery outcomes. Many stroke patients are on medications like blood thinners, blood pressure medications, or cholesterol-lowering drugs. These medications come with specific dosing and safety considerations that must be respected. Common over-the-counter medications, including pain relievers, supplements, and cold remedies, can increase bleeding risk, alter blood pressure, or interfere with the effectiveness of your prescribed treatments. This is why discussing these medications with your stroke doctor is crucial. One major reason to have this conversation is the risk of drug interactions. Stroke patients often take blood thinners such as aspirin, clopidogrel, or warfarin to prevent clot formation. However, over-the-counter drugs like non-steroidal anti-inflammatory drugs, or NSAIDs, can increase your bleeding risk or reduce how well your blood thinners work. This could lead to dangerous complications that you want to avoid. Another important factor is how some over-the-counter medications can impact your stroke risk factors. For instance, certain cold medicines contain decongestants that can raise blood pressure. This is particularly concerning for stroke survivors who need to keep their blood pressure under control. Additionally, stroke patients may be more susceptible to side effects from over-the-counter medications. For example, taking aspirin or NSAIDs can increase the risk of gastrointestinal bleeding, especially when combined with other medications. Medication management can be complex for stroke prevention. It often involves a mix of antihypertensives, statins, and antithrombotics. Your stroke doctor can guide you on which over-the-counter medications are safe to use alongside your prescriptions and which ones should be avoided or used with caution. Lastly, every stroke survivor has a unique medical history, type of stroke, and current medications. Discussing your use of over-the-counter medications allows your stroke doctor to provide personalized advice tailored to your specific health status and stroke risk profile. In summary, open communication about all medications, including over-the-counter drugs, is essential for managing stroke risk, preventing complications, and optimizing recovery. Always consult your healthcare provider before starting, stopping, or changing any over-the-counter medications. This ensures that your stroke prevention plan remains safe and effective.